Riverside is excited and honored to be the recipient of the Norling Award. We've been very pleased to be a partner with Premier and to be a partner in our communities for almost 100 years. Riverside is different and special because we do offer the full array of continuum of services across the healthcare field. What we try and do is help patients and their families wherever they are in their healthcare need, and we think of that as how do we improve the patient experience, the safety, the quality, to really make the Riverside Care difference stand out wherever we provide their care.
We've been participating in the Quest program since its inception, and that has been a really great opportunity to bring Premier folks on site with us, hands-on at the bedside. That initiative really pushes you to be at the top of your performance. It's the best of the best, which is really where we always want to be for our patients. So our participation in that program continues to grow as we expand the different initiatives that we focus on within Quest.
2 years ago, we implemented Safety Surveyor. It's given us a common language, and it's given us real-time ability to make changes that improve the care that we provide to our patients. We are looking at as many ways as possible to implement technology to help us prevent infections. Annie is an example of the use of an ultraviolet robot. Uses UVC light in a pulse that kills all bacteria and viruses within a 10-minute time frame.
Riverside Health System has supported group purchasing for many years, and we feel that Premier's purchasing program has been a great fit for our health system. Through the support of our executive team and a lot of hard work from the supply chain team and many others, I'm pleased to say that we're able to bring about $1 million in savings to our health system this year. Bringing this kind of savings will allow us to continue to invest in new technologies. It will help us to make sure that we're offering the highest level of products and services to our patients. This is what the Riverside Care difference is all about.
I think we've been recognized, and we're pleased to be recognized because of the work in partnership with Premier that has helped us reduce our readmissions in some of our rural communities by up to 20%. So helping patients and their families be able to stay at home or the place they call home without having to come back into the hospital because of maybe breakdowns in communications. We've also worked very hard to work with Premier and other groups to reduce our serious safety events by 50% over the last few years. Again, this improves the outcomes, the care that we provide, and makes all of Riverside a safer place, whether it's in the physician office, whether it's in the hospital, or whether it's in one of our nursing home or PACE centers.
The PACER initiative is a multidisciplinary team that includes not only our supply chain colleagues, but our administrative staff as well as physicians, where the physicians review the clinical data. With that information, we're able to choose among health systems what is best practice. The exciting portion of the PACER initiative is that we spend the majority of our time not on cost. It's about clinical effectiveness. It's about taking new innovations and making certain that they produce the outcomes that we expect for our patients. And if they do, how do we capitalize on minimizing the variation in the products that we use to minimize cost and deliver the best technology to our patients?
Every day we come to work to live the Riverside Care difference, and what that means to us is keeping our patients free from harm, helping them to heal and achieve the best possible outcomes in their care, and being kind to them and respecting their wishes. As we've been working with Premier, it's been apparent that they're in it with us. It's great to know that Premier is with us and that we'll be working together to meet those goals across the country with the entire Premier membership. There's a lot of great work ahead of us, and we're just really excited to be partnering with them on that.
Just because you've left the hospital doesn't mean that Riverside has stopped caring for you. Care-focused transitions helps us to manage care of our patients through engagement, contact, awareness, and voice of the customer. Customers who complete the transitions callback discharge survey are at 8% less risk of readmission than their peers.
We have a great long-standing partnership with Premier. Goes back to the founding of Premier in the early 2000s. Riverside was one of only 200 hospitals that participated with Premier in the hospital quality pilot program. Over the last few years, we've continued to expand and work with them on some of the new clinically integrated networks, population health, through the PACT collaborative. So our expectation is that we will continue to partner with Premier, and that will help us to continue to provide outstanding care, the Riverside care difference in our community.